Hi everyone, my name is Ian Patton and I'm the Director of Advocacy and Public Engagement for Obesity Canada. As a physician, your role in patient education is important and your patients are going to look to you as an authority on the topic. It's unlikely though that you're going to be able to have the time to dedicate to cover every relevant piece of information. It's also possible that your patients are going to be eager to explore the subject in greater detail on their own. So what you do share with them or where you direct them to find more information is going to be vitally important because this space is filled with an abundance of misinformation. You can let Obesity Canada be your trusted resource. I'm going to highlight some free resources that you can share with your patients to supplement the clinical education that you provide, support patients in their chronic disease management, and tools that can help them access healthcare. First is OC Connect. OC Connect is Obesity Canada's private, moderated peer support community for people living with obesity, created by people living with obesity. We currently have about 3,000 members in there. It is a safe space where your patients will be exposed to evidence-based information and be able to share and engage with their peers. As a healthcare professional, you can trust that your patients will get the benefits of being involved in a peer support community without the mass of misinformation found in other open support groups. Second, Obesity Canada regularly does public education that is based on the evidence-based clinical practice guidelines. Connected Conversations is a public-facing webinar series that covers everything from diet culture to treatment options to weight bias. The recordings are available on our website as well as on our YouTube page. Similarly, the annual Connected Conference is a virtual conference that takes place on World Obesity Day every year. World Obesity Day falls on March 4th, and again, all of the previous years of the conference are archived on our webpage as well as on our YouTube page. I also find that many people in our community are interested in digging into more in-depth information. Our clinical practice guidelines are unique in that they were developed with lived experience input and include key messages for people living with obesity throughout. As a healthcare professional, you can direct your patients to explore the clinical practice guidelines in more detail on our webpage. It is possible that your patients may come across barriers to accessing treatments or other healthcare. Obesity Canada is regularly involved in advocating for improved access to care and regularly supports patients in their efforts. You can direct patients to our webpage where they can find tools for accessing healthcare, such as pre-drafted letters that they can use with insurance or with their employers, and our Obesity Care Finder tool, which will help them find specialized obesity care in their area. We also have specialized training on patient advocacy for individuals who are looking to speak up for themselves or for others. Finally, as the Director of Advocacy and Public Engagement for Obesity Canada, and as a patient advocate myself, you can use me as a resource if you cannot find what it is that you're looking for or what your patient needs. I hope you find these resources useful that I shared with you today, and if there's anything that's missing that you think would be needed, please reach out to Obesity Canada and we'll try and make that happen.